Hi, and welcome back to part 3 of Savoring, Flow, and Mindfulness. And in this one, we're looking at mindfulness. Now, do you know how there are days where you wish you could just stop and do nothing? Just be. Mindfulness meditation may be the thing you need to try. When engaged in mindfulness meditation, you focus on breathing and the here and now only, while other things and thoughts are recognized and then let go and refocus on your breathing. Now, the benefits of mindfulness meditation are evidence-based and restorative. As we will learn, the benefits are credible and meaningful to ourselves and our life experience. So, let's now move into the third and the final concept of mindfulness. Mindfulness meditation is a way of training your mind to deal more effectively with mind wandering or daydreaming, negative mood states that come from the way that we react to normal mood fluctuations that occur during mind wandering. Well, let's clarify. Mind wandering, well, it's associated with a particular brain state called default mode of brain function, which evolved to help our prehistoric ancestors scan the environment for big physical threats, saber-toothed tigers, mammoths, bears, landslides, floods. And seeing no threat, then we could carry on eating, working, mating, and all the other prehistoric ancestral activities. While in modern life, mind wandering and the default mode of brain function involves thinking about any minor social threats that lead to normal mood fluctuations, the ups and downs of a course of a day. Normal mood fluctuations, like being a little sad, angry, or anxious, don't make us distressed. The way we react to normal mood fluctuations cause a downward spiral of distress. This can include, and we've all probably had these experiences, but this can include the ruminating endlessly about small negative past events. Ruminating means you're going over the event time and time again. Secondly, worrying about the future and anticipating the worst. Third, making harsh negative judgments about how we managed small past negative events and will handle future challenges. And then lastly, trying to suppress normal mood functions. Well, instead, mindfulness meditation allows us to become more skillful at recognizing that our recollections of and rumination about past episodes of distress and our worries about future are not objective facts. They are subjective thoughts. And that's an important distinction. Now, the history of mindfulness could be found in Buddhism, where meditation was imported into the contemporary positive psychology from Buddhism. Mindfulness involves paying attention deliberately and on purpose in the present moment without judgment to our immediate sensory experience with an attitude of curiosity, openness, and acceptance. Now, this is a definition from the University of Toronto based on a consensus within the psychological research community. Now, an important distinction, and I've already sort of alluded to it, is that thoughts are not facts. Thoughts and feelings are construed as transient, subjective phenomena, but not permanent facts about the world. Our thinking comes from our perception about the world around us, and my perception is based on my age, where I was born, what experiences I've had in my life, how many siblings I have, what kind of work I've done. All of that informs me of my perspective, but yours will be completely different than mine because you're from a different family, different part of the world, different life experiences. Therefore, your view of the world is going to be different from mine. Therefore, thoughts can't be facts. Because therefore, my thought, if it's a fact, your thought can't be a fact if it's on the same issue. All right? So thoughts are not facts. Now let's also revisit mind wandering. Because during mindfulness meditation, attention will inevitably wander to regrets or sadness or anger about the past, or worries and anxieties about the future. However, when this happens during mindfulness meditation, we guide our attention back to our breathing or other awarenesses about our body. By doing this, we avoid becoming embroiled in judging these thoughts and feelings or trying to change them. Instead, we accept them for what they are. They are transient, subjective phenomena. So in mindfulness meditation, we accept that negative, positive, and neutral thoughts will enter the mind and distract attention away from focus on the immediate sensory experience, like breathing or other body awarenesses. Each time this happens, we gently bring attention back to our immediate sensory experience. We acknowledge that the thoughts that distract us from our immediate sensory experience will stay briefly and then dissolve. We avoid becoming embroiled in trying to change them, judge them, or even stop them. We suspend attempts to look to the past for guidance or how to solve problems in the present and plan for the future. I would really like it if you would check out box 4.14, Mindfulness of the Breath and Body, box 4.15, Body Scan Meditation, and box 4.16, which is a 3-minute breathing space. Give them a try. Mindfulness is both state induced by meditation and trait that refer to the disposition of living mindfully. As you may assess your level of trait mindfulness by completing the 5-facet of mindfulness questionnaire. That's box 4.13, which assesses the capacity to 1. Observe the world as it is now. 2. Describe these immediate experiences. 3. Act with awareness by focusing on what is happening in the present moment. And then 4. Be non-judgmental and refrain from making judgments about whether your immediate experience is good, is bad, or is ugly. Next, also be non-reactive to negative thoughts and feelings. Now, for the evidence-based mindfulness programs, you'll find box 4.14 to 4.16, where you'll see the mindfulness-based stress reduction, which is the MBSR. It was developed by John Kabat-Zinn for people with painful medical conditions and to help healthy people manage stress. The mindfulness-based cognitive therapy, the MBCT, is an adaptation of the MBSR, and it was developed by Zindel Siegel and Mark Williams and John Teasdale to help people with chronic depression delay or avoid relapsing. The MBSR, which combines mindfulness meditation with yoga, was designed to help chronic pain patients and stressed, healthy people. MBCT, which combines cognitive therapy, which is like the talk therapy, with mindfulness meditation, was designed to prevent relapse in people suffering from chronic relapsing depression. There is also included an 8-week group sessions. Both the MBSR and the MBCT are offered as group training or therapy programs. They include 8 weekly 2.5 to 3 hour sessions, 1 a day retreat, and regular daily homework of about 45 minutes between sessions, some of which are supported by audio recorded guidance. So what does the research say about mindfulness? Well, it says that healthy adults and children, compared with non-intervention mindfulness meditation retreats and briefer mindfulness interventions, have positive effects on many indices of well-being and stress up to 3 to 6 months after mindfulness intervention. So the follow-up, even 3 to 6 months, those effects were still being shown. Effects range from small to large, with longer programs having the best effect. The effects of mindlessness and active interventions like relaxation training are similar. Work performance is affected by mindfulness. Compared with non-intervention control groups in businesses, schools, and healthcare services, mindful interventions promote job satisfaction, work performance, health, and well-being at 4 months follow-up. So it has it does seem to have an ability to stick to things for a little period of time after the work is done. So if you were to continue on with this, it would continue to extend beyond the 4 months or the 3 to 6 months. Mindfulness has a greater positive effect on job satisfaction than on the job performance. So we feel better about the work that's being done, even if the performance isn't showing the same positive shift. Mindfulness is no more effective than other stress management interventions such as relaxation training and yoga. Now, for sports and mindfulness, the interventions enhance performance by athletes, cyclists, dart throwers, hammer throwers, hockey players, hurdlers, judo players. These have all been tried out and played out and have found to be an effective strategy. Compared with non-intervention control groups, mindfulness interventions have large positive effects on performance, mindfulness, flow, and competitive anxiety. Now, what role, if any, does mindfulness have on mental health disorders? Well, mindfulness interventions have a positive effect. Depression, anxiety, and PTSD are positively affected. Addictions, eating disorders, and psychosis, as well as ADHD in children, are all positively affected by mindfulness meditation. And again, compared with non-intervention or treatments as usual, they lead to small to medium reductions in symptoms of depression, anxiety, and stress, an increase in the quality of life at 6 to 12 months follow-up. Mindfulness interventions have similar effect to other evidence-based interventions, for example, CBT or medication. CBT is cognitive behavior management or cognitive behavior therapy. An example of this could be like talk therapy, but looking at the behavior associated with it. It could involve token economy as well. So what about physical health disorders? How does mindfulness affect physical health disorders. Well, compared with treatment as usual or no treatment control groups, mindfulness-based interventions have a small positive effect on pain reduction and an ameliorating of depressive symptoms in people with chronic pain conditions. So I would imagine too, the research would support that the longer one uses mindfulness over the long haul would have a longer positive effect. Mindfulness-based interventions also improve psychological adjustment for people experiencing cancer, vascular disease, HIV and AIDS, multiple sclerosis, diabetes, inflammatory bowel disease, and traumatic brain injury. Excuse me. Now, self-help and online mindfulness programs. Well, that's an interesting, because a lot of things that we do find successful, we make an effort to put them in an online type of environment. Now, these yield small to medium positive effects for people with and without clinical problems of mindfulness, depression, and anxiety symptoms. The longer self-help programs are much more effective. So how does mindfulness work? We're going to break this down. It's an interesting division. You break it down into the being mode and the doing mode. Mindfulness helps us to become skilled at switching from the doing mode to the being mode. The doing mode is useful for solving external problems. It is, however, not so good, maladaptive when used to solve the internal problems, such as managing distressing emotions. If feeling a bit sad in the doing mode, we may ruminate about why we feel sad, remember previous episodes of sadness, and catastrophize about the future, and even feel sadder. At these times, we feel better if we shift gears from the doing to the being mode. Now have a look at the graphic I've put beside me there. Let's look a little closer here now. The conscious choice versus automatic pilot. The risk of automatic pilot is that we may miss much of our lives in the doing mode. Automatic pilot means we just move along and we don't really carefully pay attention because it's on automatic pilot. Being mode, we are more mindful of what we are doing and the actions that we take on those choices. Relaxing to experience through direct sensation versus abstract thought. Now this one here, the risk is to focus only on ideas and thoughts about the world instead of what our immediate sensations are of being in the world, the here and now. Next is acceptance versus striving to change things. Now, the doing mode, we tend to make judgments, comparing how things are now and how we want them to be. In the being mode, we instead suspend judgment. That is, we accept how things are now in the moment, thus create space to choose a better path. Thoughts as mental events versus thoughts as facts. In the doing mode, thoughts are seen as facts or accurate reflections of objective reality. But we've already said, my reality and yours were probably different because we don't have the same background, therefore we don't see the world in the same way. Then in the being mode, we mindfully observe these sorts of thoughts, watch them come into our mind, linger, and dissolve in our mind. The next then is that we can approach unpleasant experiences with more curiosity versus avoidance. So in the doing mode, we solve problems by pursuing goals and actively avoiding going in directions contrary to the goal. In the being mode, we turn toward and approach distressing emotions. we are curious about them. We acknowledge them mindfully and non-judgmentally. This gradually weakens them and gives us hope that things will improve. Then next, living in the present versus mental time travel. And we'll get into that here. In the doing mode, we use our memory of how we solved problems in the past and our planning and forecasting ability to anticipate how things will unfold in the future. Action-based. In the being mode, we see our memories and forecast as transient mental events constructed by the mind, not permanent objective facts. Self-compassion and nourishing activities versus self-criticism and depleting activities. Now again, this is a separation of doing and being. In the doing mode, the pursuit of meaningful goals can be very demanding, both in terms of how much time it takes, also in the self-criticism that we might give ourselves. In the being mode, it can help us acknowledge when we need to take time to nourish ourselves, to show self-compassion. It can also help us have the courage to do so. So let's try this out. I've posted a video in the same place where I've posted these videos. In the same place in Blackboard. And the video that I posted is a guide of mindfulness meditation video by John Kabat-Zinn. Now he's going to guide you with his words, and there will be long gaps of a minute, 2, or even 3 minutes long. The key there is just to continue with the last instruction he gave you, and likely that will be to continue to focus on your breathing. But give it a try and see, do a post test, do a little paragraph of how you feel, what you're thinking about, what's your experience on a scale of 1 to 10, where 1 is low and 10 is high, about how you feel today, what you think your prospects are today. Just get a little pre and post, pre-test, do this short relaxation, and do the same questions after and see if there's any difference. You might be surprised. Okay, let's carry on with some of the positive psychological effects of mindfulness training that can lead to a lower resting heart rate. It can also affect, in terms of your physical components, ambulatory systolic blood pressure and systolic blood pressure following a stress test. It helps to lower things. The positive psychological effects of mindfulness are subversed by its impact on functioning and structure of the brain. Now, functional brain imaging studies show that mindfulness meditation affects brain regions involved in attention control, emotion regulation, self-awareness, and empathy. And that could help us explain why we can get into a more calmed and relaxed state and allow ourselves to enjoy and participate in mindfulness. The structural brain image studies have shown that long-term meditation leads to a thickening of the cortex and changes to the size of some brain regions, which are activated in studies of brain functioning and mediation. And meditation. So this just really shows us that mindfulness can actually strengthen the neural fibers within our brains such that they recruit more neural fibers. Mindfulness meditation training reduces both heart rate and blood pressure. This may be one pathway through which it reduces our perceived stress. Trait mindfulness is associated with the following personality traits: emotional stability, conscientiousness, and agreeableness. Trait mindfulness is also associated with a range of positive personal characteristics and low level of number of problematic attributes. Okay, everybody, there we go. That's mindfulness. Now, please take the time, if you wouldn't mind, and explore some of the exercises to see what role savoring, flow, and mindfulness can have for you. These are tools that can be applied, that you could use to really move towards greater happiness and more awareness of what the good life for you will be in your future. So I really hope you take the time to do some of the activities. All right, everybody, good luck, and we'll see you in the next video. Bye now.